Now this is a very interesting ECG. You can simply pause the video and you can simply try to figure out what is the problem in this ECG. So if you're paused and seen, then there are two problems in the ECG. Actually, the patient presented with chest pain, and if you can make out, the patient was having chest pain since 2 days, and if you can make out, here lies the problem. Here is the basically a very nice PQ wave. We can very nicely make out the Q wave. We can make out very crystal clear that it is there is basically a very prominent Q wave. So as we know, Q wave is the first negative wave after P wave. So we can make out Q wave here, Q wave here, Q wave here, and Q wave is pretty strongly present there. And you can make out in V5. In V5 there is not even a single millimeter Q wave. In V6 there is not even a single Q wave. There is not even a single of Q wave. So it is not there at all. So what does it tell you? That the Q wave is not present here. It is not present here, but it is definitely and instinctively present here in V1, in V2, in V3 as well. So this patient actually had a recent anteroseptal wall MI, and he was having the chest pain since 2 days. That is the reason he was admitted. So this was in short an evolved anteroseptal wall MI, which was evident by this prominent Q wave and the ST elevation which is here. The second thing is we can also make out that there is presence of Q wave in lead 2, 3 and AVF. So we can very crystal clearly make out that there is Q wave presence in lead 2, 3 AVF. It means the patient must have had an old inferior wall MI. I don't know the timing when it was. It could have been like an year ago or 2 year ago, but it is there. So always try to look for the Q waves, because Q wave will tell you that patient had earlier MI. So Q wave should be present in the consecutive leads. If it is present in consecutive leads, then it suggests that it is significant, and usually it should not be present at all. It is very commonly present in lead 3, but when it is seen in all the consecutive leads, that is lead 2, 3 and AVF, we call it a significant Q wave. Thank you.